And we're joined here today by David Sutton, President and COO of NanoSphere. Welcome to the show.
Thank you. Happy to be here.
So we were going to go over a couple of things, but just before we really dive into the interview, for those who are just hearing about you or have seen your ticker or your company in passing, but haven't really dived into your company, who is NanoSphere and what do you do?
Yeah, we are a healthcare technology company with a patented delivery system that increases the bioavailability or effectiveness of a lot of bioactive components, things like medications, nutraceuticals, and what's really exciting, cannabis as well. We have a patent in that for our delivery technology. And what it allows us to do is increase the effectiveness of the cannabinoids. You know, traditionally, ingested cannabis has a very low bioavailability. And what we can do is we can nano-encapsulate those cannabinoids to increase the bioavailability, increase the onset of actions with a repeatable dose.
Yeah, and it's actually what you touched on a point there that has come to my attention a lot in recent months. A lot of people are talking about is that when you start transforming or manipulating cannabis in any sort of way, whether you put it into an edible, whether you put it into a liquid, as soon as heat is involved, you start really changing the chemical compound of cannabis. And are you saying that your products are able to make that process smoother or better, or that's just the focus that you're on right now is going into, like, say, a strictly THC or CBD and a bunch of different formulations that way?
So what we know is that the dose that we deliver, we actually avoid a lot of those issues that can be caused when you digest cannabis. You know, there's a lot of destructive factors. There's low uptake because it is lipophilic. What our technology allows us to do is administer cannabis either through the skin, through the buccal area of the mouth, and even intranasally. This provides a more consistent dose, no matter what the specific cannabinoid content is. For example, our nano serum, which is currently on the market in Colorado, soon to be in California as well, is applied through the skin, and it's a very effective transdermal product to treat pain and anxiety. It's delivered in dose meter pen, so you know what you're getting every single time you take it. We have several products coming out into the market next year, an intraoral product and an intranasal. Both of these provide very consistent dosage amounts. In fact, our human PK blood study showed that our onset of THC through the area is within 10 minutes. So the benefits of our technology really showed to have that good onset that you can rely upon.
Yeah, and that's really important, actually, 10 minutes, because usually for those who are just starting to learn a little bit more about cannabis and ingesting it, usually it has to pass to your liver and through a bunch of other things. It takes usually 45 minutes to an hour for that to onset, and for a medication, you can't have onset of an hour. You know, a lot of people they need that as soon as possible. So for an edible to be in 10 minutes, that's actually that's really good. I like hearing that, actually.
Yeah, and so and we don't really call it an edible. You know, we call it our intraoral product because, again, the problem with edibles is all that variability and the potential stacking effect. You know, when you take a edible and you wait those 45 minutes and it's still not working, you may take another dose. Well, 2 hours down the road, you could be hit with a very powerful effect that you weren't looking for. With our technology, administering both through the buccal area of the mouth and through the nose, you're going to start feeling it almost immediately, and that's going to prevent accidental over-administration.
And doctors will love that aspect, actually, because that's what they want. But this is also could easily be used recreationally as well. So not just to segregate it just to medical. Some people obviously don't like smoking, so they go through other means to partake in cannabis as well. So it's interesting. Now, does that have to do? There was a recent news release that just came out. That was that NanoSphere develops a new product line eliminating the need to smoke cannabis. Is that the same that we're talking about right now, or is this another new product that you've just brought onto the market?
No, that is what we're talking about here. It is our intraoral and intranasal applications. You know, you just mentioned the recreational opportunity for these products. Both the intranasal and the intraoral have a very quick onset. particularly the intranasal, what we found in initial testing is an onset within 80 seconds, which is tremendous. It's a low dose, but a very powerful effect, so you need less to get more. It's discreet, and so we really see this being a very, very strong recreational product.
Absolutely, in 80 seconds, that's very fast. Now, let's switch a little gears here. When it comes to selling your product or different supply deals or strategic partnerships moving forward, what's your goal in building this company? Are you selling straight to the end user? Are you wholesaling? Do you have partnerships in this field?
So yeah, it is partnerships. You know, because we're based in the U.S., what we have to do is license our technology with 2 individual licensees in each state. Currently, we're not allowed to ship product across state lines, so we can't build a large manufacturing site and ship out nationwide. We have to select, you know, highly qualified partners that are operating in the legal markets. We then go in with our equipment. We teach them how to build our technology and our products. We license our brand, and we assist them in their marketing efforts. This keeps us, you know, moving quickly, while also reducing our risk as we actually don't touch the plant. So it keeps us a little, it de-risks us from the federal regulations, if you will.
Yeah, and it's an interesting situation in the States because each state obviously has different jurisdictions. You've got to be able to partner with other states in order to cross the borders like you were talking about. But also there's so much talk about legalization federally. I think it's heated up even more in recent weeks and months. So it'll be very interesting to see what happens in the coming weeks and months to see how that progresses. And I believe even the farm bill, I think we're supposed to hear about that today or tomorrow. Forgive me if it's already come out and I haven't noticed it this morning, but that in itself, although that's more so towards hemp, that's a huge step forward for U.S. cannabis in general.
Absolutely. You know, we are actually building out a large production facility for our hemp-based CBD product. This will be available across state lines, so we're very excited to see what comes out in the Farm Bill. And even when it does, you know, when the THC side of things become unrestricted, if you will, our model allows us to turn those licensees into distribution hubs. So what we'll be able to do is scale our manufacturing systems here in Colorado and then ship bulk to this state, so no one gets hurt in the process.
No, and you're right, and it's good to hear. And you know that, as I said earlier, that's going to be a big development for the United States. So I'm looking forward to seeing our brothers and sisters south of the border starting to push forward with more legalization. Now, I've noticed something in the back there. It seems like there's a cannabis cup in your back. Is that an award for something?
Yeah, that's an award we won last year for Best Transdermal. It was Dope Magazine's analysis of you know, industry-wide products, and we took home Best Transdermal, so we're very excited about that. What we're really proud about is the Frost & Sullivan Technology Innovation Award we won this year. That's a tremendous honor. You know, companies that have won in past years have been companies like 3M. So to be among those participants is quite an honor.
Yeah, congratulations on that. It's always nice seeing those different elements and being rewarded for part of your craft, what you're doing for your company. I'd like to turn attention to a question one of our investors had asked, as we turned to our investors community and asked who would have questions for you for today. So one of the questions was, do you have to wait until the concentration market is opened up legislatively in Canada to get your products approved for sale in Canada?
So we're actually working on a special formula to fit Health Canada's restrictive guidelines, if you will. We're tweaking our own formula and testing it right now, and should be submitting an application here in the coming month.
Gotcha, and that actually ties right into that into our investors' next question. It actually answers it already. Is talking about entering Canada and exporting to the Canadian market. It sounds like you've already started that process. You're working with Health Canada to make that come to fruition.
Yes, and with Delta 9, who we've been working out our deal together for the past couple of months now, and hopefully we'll get that wrapped up here soon. And they will be our licensed partner for the Canadian market, as well as our global distribution partner as well.
I did not know that, actually. I met their CEO earlier this year and got a chance to talk to him. They've got that pod system of growing cannabis. I really liked him. He was a smart guy. He was passionate. So yeah, I didn't know that connection. It's good to know that, actually.
Yeah, now, we're very excited about it. We love.
Oh, sorry.
No, that's fine.
Moving into the structure of your actual stock and what you're excited about. So looking at your share structure, how many shares are outstanding, and do you have a number of ownership from insiders and management for your company?
Yeah, so there's roughly 97 million shares outstanding. We, like many companies, completed an RTO last year where the company holds 60% of those shares. So the majority of the shares outstanding are held by insiders. They're still under a lockup period for another 2 years. The float is very stable.
Good to hear. And when it comes to different warrants and options that are out there, you're currently sitting around 33 cents Canadian. Is there any, what are the paper situation out there? Are there people with really cheap warrants and options out there, or are we in a good state of, we've building a good base, ready to move forward with the share price?
By now what we've seen over the past year has been some liquidation of some cheap paper. By now that should be over with. We think the downward pressure on our stock is just market wide right now. But it's an excellent time to buy. We've got a lot of great things coming up next year. So we're really excited about it. I think that it's a tremendous value right now.
Good to hear. And yeah, and the market in itself, I mean, you could talk about anywhere in North America, from the smallest tier to the highest tier of cannabis companies. There's always been pressure recently. We'll wait to see when that subsides. But moving forward, no, it's good to hear all these different things. People want to know more about a company, and I appreciate the time that you've taken to come on here and talk about your company to both myself, but all the viewers and investors watching this as well. And if you want to look into more, it's NSHS on the CSC. You can find them, NanoSphere Health. And do you have a website or I'm sure you do, but the website that you have for investors to look into a little bit more?
Yes, yeah, nanospherehealth.com. For information on our products, specifically in the cannabis sector, it's evolvedformulas.com.
Beautiful. Well, I appreciate it very much for coming on the show. I know it's really early in the morning over in Colorado, so thank you for coming on. We look forward to seeing what you have in store for the rest of the year, but especially going into 2019.
Yes, happy to be here. Thank you so much.